What is exaggerated startle response? Have you ever jumped at a loud noise or a sudden movement? For some people, this reaction is much stronger than usual. This heightened reaction is known as an exaggerated startle response. It occurs when someone reacts more intensely or quickly to unexpected stimuli, like loud sounds or quick movements. This response is a normal reflex that helps protect us from potential dangers. However, when it becomes exaggerated, it can lead to distress and disruption in daily life. In the context of post-traumatic stress disorder, or PTSD, an exaggerated startle response is a key symptom. Many individuals with PTSD report being easily startled or reacting strongly to situations that would not typically provoke such a reaction. This heightened sensitivity is linked to how the nervous system becomes more reactive after experiencing trauma. Essentially, the body remains on high alert, making it more sensitive to perceived threats. Research indicates that the exaggerated startle response in PTSD is not merely about loud noises. It is particularly pronounced in contexts where the person feels threatened or unsafe, even if the actual stimulus is not dangerous. For instance, a person with PTSD may react strongly to a car backfiring if it occurs in a setting that reminds them of a past traumatic event. Studies have shown that individuals with PTSD can exhibit larger physiological responses when startled. This can include bigger eye blinks, increased sweating, or faster heart rates. These reactions can be objectively measured in controlled settings. However, it is important to note that not everyone with PTSD will experience an exaggerated startle response in every situation. The response tends to be most intense when the individual anticipates something unpleasant or feels threatened. It is also crucial to differentiate an exaggerated startle response in PTSD from other medical conditions that may cause similar symptoms. For example, hyperekplexia is a rare neurological disorder where exaggerated startle responses are not linked to trauma but rather stem from a genetic mutation affecting the nervous system. Managing an exaggerated startle response can be challenging for those with PTSD. It often leads to increased anxiety, hypervigilance, and difficulty relaxing. Fortunately, treatment options are available. Approaches like cognitive behavioral therapy and exposure therapy are commonly used to help individuals process traumatic memories and reduce their sensitivity to triggers. In summary, an exaggerated startle response in PTSD reflects a heightened state of alertness and reactivity following trauma. It is influenced by emotional and situational contexts, not just loud noises or sudden movements. Effective treatment focuses on addressing the underlying trauma and helping individuals regain a sense of safety and control. Always consult a healthcare professional for personalized advice and treatment options.